This is Paul Lavrakas. I've been an AAPOR member for 36 years.
I've been an AAPOR member for 4 years.
I'm talking briefly today about some surveying, national surveying that I did with Scott Richards at Reconnect Research in my capacity as a consultant regarding the public's, general public's reaction to the virus and the pandemic. In March and April, for over a 6-week period, Reconnect Research conducted over 16,000 interviews with adults in all 50 states using the RICS IVR surveying approach. RICS is a special telephone surveying approach, and IVR is, as you probably know, a data collection means in which there's no interviewer involved. For these surveys, the AAPOR RR1 response rate was about 9%, which is comparable to many general public RDD surveys. And one thing I want to note is that we found an overestimate exposure to the virus of approximately 1.2%, which was not necessarily a surprise. And we think that this is likely associated with differential non-response because people who thought they had the virus or were especially interested in it were more likely to complete the questionnaire, so we believe. Overall, what we found, and I think it's very interesting, is that the reactions of Republicans as a group compared to Democrats and independents were in line with how the president was characterizing the virus. In other words, as less serious than many medical experts were characterizing it, as was reported by the news media. Here you see the approval and how it differs by party affiliation, strikingly differs by party affiliation. And it was quite stable over these 6 weeks period. You'll see here that Republicans as a group pretty much were from the mid-70s to the upper 80s in their approval. And it sort of was ticking up towards the end. Independents, the orange line in the middle, started out a little higher than they finished up, with about approval of most of the time in the upper 50s. Democrats started a little higher the first 2 weeks and then dropped down into the 40s and seemed to stabilize right there at about the mid-40s. As you heard me say earlier, Republicans were quite different in many ways, not just on government approval. What we found across the field period was that Republicans were consistently more likely to report that they were experiencing virus-like symptoms, yet they understood little or nothing about the virus. They believed that the virus spread was under control or that the spread of the virus would be under control within a couple of months. They had changed their lives very little or not at all because of the virus, and that they knew little or nothing about how to prevent the virus. Obviously, this isn't all Republicans, but they had a tendency, and it was a statistically significant tendency, to report these things much more likely than independents and Democrats. Thank you.